Hello, and welcome to another episode of Without Pain Wednesday, where we get together once a week to talk about a different topic related to getting out of the back pain cycle for good. I'm Dr. Ryan Peebles, and I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. This week's topic is going to be a little bit different. It's going to be a kind of a case study on one particular student and then just into answering a bunch of student questions. If you don't already know, we did not have a stream last week because I was out having my first experience with COVID. And just to update you guys, I'm doing a lot better. It took me down for about 4 days. It was pretty rough, and I have been just gradually getting a little bit better each day. I think I quickly got back to like 90%, and that last 10% of recovery I think is going to take a couple weeks, just with how it's been going and what I know about COVID, and that's just my expectation. So thank you everyone for the well wishes while I was down for the count. I appreciated so many kind words coming from you, from the students, and I'm happy to be back. So yeah, during that time some questions piled up, and we're gonna get through a bunch of questions today. I wanted to share one thing I learned from my experience, and so that's going to be like a little mini topic. It's about a book I read during the time that I was sick. I listened to the book Breath on Audible while I was sick, and I learned a lot. And it's a book I had been wanting to read for a while now because I'm interested in breathing, and I learned more than I expected. It's a really well written book with lots of research, and I recommend it. So that is and I'm blanking on the author right now. I'm actually gonna look it up for you because I believe that's kind of important with a pretty general title like Breath. I'm sure there's another book out there. So this author is named James Nestor. And I thought it was relevant because COVID is a disease of the lungs. The virus does tend to go to the lungs, whether that's the lower respiratory or the upper respiratory, and there's a lot that you can do with your breath to help things along. And from this book, one of the major takeaways I had was how important it is to breathe through your nose. And so I wanted to pass that along to you, whether you're awake or asleep, that breathing through the nose, just relaxed breathing in and out through the nose is one of the easiest, most powerful changes you can make if you are a person that tends to breathe through the mouth. And there's so many different reasons, from just the nose warming and cleansing the air before it gets into the lungs, and the amount of the rate of breathing that happens when you breathe through your nose, and there's just so many more benefits that I don't have time to get into, but that is one easy change, maybe not easy but simple change that people can make to improve their general health. And then another thing that I found really interesting was this kind of the second emphasis that he had in the book was about exhaling all of your air. So full exhales and how important it is. And I liked reading that because that's something that I emphasize. It was something that was taught to me by a respiratory therapist in the hospital when I used to work in the hospital. And I really resonated with that, and I immediately understood the value. It made sense to me, and I've passed that along to my patients and my students in the program. Not only does it make room for new fresh air to come in when you completely empty your lungs, but it also has the effect that we use it in the program for, which is activating your abdominals. So a full forceful exhale will activate the deep core, and it's a fantastic way for anyone to feel those muscles and just wake them up if they haven't been woken up in a while. So just kind of reinforced something that I practice and I teach, and I wanted to kind of share that it's now supported by science, by research. So make sure you're breathing out all your air. I think as I get older, as I get more experienced, the one thing that just continually becomes more important and more valuable over time, endlessly, and I think it will forever do this, is the importance of breathing properly. With the rib cage down, the diaphragm angled downward instead of forward. That's part of the rib cage being down. And so teaching yourself to breathe that way, fluidly, in a relaxed way, is something you can do for your entire life. And it's going to have an incredibly powerful, positive impact on the health of your lower back and your core, to be able to have that connection with your abdominals and that posture of your deep anatomy. So just reemphasizing, the first lesson of the program is probably the most important lesson, and it's the foundation of everything that we learn afterwards, the 3 anchors, and the movement retraining that follows. It needs to come on a strong foundation of proper breathing. And so exhale all your air, feel your abdominals contract, and then try to inhale with that engagement so that your rib cage stays down. It doesn't lift up and get pushed forward by the diaphragm because your abdominals don't have enough tension in them. And so this is something that I'm going to continue to improve for the rest of my life, and I hope that you do too. So let's get to our case study. I think I covered most of the housekeeping for now. And so this is going to be a student who is in a particular situation, training for a big life event, climbing Mount Rainier, and experiencing some increased symptoms, problems, knee pain, and increased symptoms in her back. So I'm not going to use names because we're going to get into a lot of detail, so just out of respect, we'll call this person the just travel nurse is what is who it is. That's her profession. And so we'll talk about some of these details, and then you can kind of get an idea of my thought process, the questions I would ask, and the suggestions that I would make for in a situation like this. So this is a travel nurse who is a hiker, climber, mountaineer, currently training to climb Mount Rainier. And that's supposed to happen in about, well, it was 1 month, but this is from a week and a half ago. I was supposed to do this last week. So it's probably about 3 weeks away. and she says she should be training harder, but she's being held back by these injuries to her knees and worsening some symptoms in her back that are feeling a little bit worse. So I have a little more detail from my communication with her about the knees. There may or may not have been some, like trauma type injuries to the knees. She's not totally sure, but there's been several small events that could have caused the knees to hurt, or one of them. But in general, both knees are getting worse. So her training for just general life and also for the mountaineering involves hiking with weighted packs. That's like 1 to 2 times a week, going about 4,000 feet of elevation. She goes to the gym, I believe 4 to 5 times a week. And she's doing that also while doing sometimes 6 nights in a row of travel nursing shifts. So that can be quite an intense job. It sounds like it might be night shift too, so that will have an impact on just lifestyle, general health. And so simultaneously, 6 12-hour shifts in a row, and then potentially also going to the gym 5 times during that, and then taking a day off for rest. She's also doing the core balance training program. I believe she's probably around, I'm not exactly sure, maybe week, like module 2 or 3. And then she does some stretching and foam rolling. So I already said gym's 4 to 5 times a week. In the gym, she'll do Stairmaster, split squats, box jumps, leg press, leg extensions, leg curls, hip abduction, hip adduction, probably the machines, glute machines, deadlifts, biceps to tricep curl, bicep curls, tricep extensions, and a lot more. There's a whole list I could read from, but we're just going to assume that she's doing a lot in the gym, a lot of lifts, a lot of machines, a lot of training, heavy duty training. Her symptoms are increasing in both knees and the back, and even a little bit in the feet. She's feeling high levels of stress. She has like general aching in the back. She's starting to get some tingling in the knees, which is a bit scary. Some burning in the top of the pelvis in the back, so that's like something maybe she had experienced in the past, but it's coming back and maybe getting a little worse. She feels a lot of tightness in her lateral knees. She wants to stretch her knees. She wants to stretch her quads, but she can't without getting that stretch going into the knee, probably causing some knee pain. She has an interesting urge to lock her knees out while standing. And so she'll like straighten them and lock them and then realize what she's doing and then unlock them and bend them. Her knees crack every time when she goes from bent to straight. Her hips, pelvis, and low back also crack a lot with movement. So that's a lot of symptoms, and I have some of those symptoms are very telling to me about what's going on, so I will share that. Some other factors are lots of driving, poor mattress, because she's a traveler. She's renting probably a furnished studio or place like that. And she believes she has anterior pelvic tilt, and she does have to do more sitting than she'd like for documentation at work, and sitting is uncomfortable. So this is a general background. I know that's a lot of information, so I'm just going to talk a little bit, and then we'll get into some more. I have a little more information too. So the first thing that really pops out to me is that I believe that this case of this training regimen is too much. And I've already told her this. And so that's not going to be new information, but maybe for anybody else watching, that is, at this current time, my strong recommendation is going to be to do less. And if it weren't for the pain, if there were, some goal to train for, like a marathon or climbing a mountain, then this level of training would not be potentially too much. It could be appropriate if there were no pain, or at least the trajectory of pain is not going up. It seems like that things are getting worse, and so that's a red flag to make a change. If you can see that there's a trajectory in the wrong direction, something has to change. That's just the most definite thing, is that something has to change because we're going in the wrong direction. And it just stands out to me that there is a lot of lifts being done, a lot of training peripheral muscles like arm and leg muscles. And this particular student has shared with me in the past that she has a hard time connecting with her anchors and with her core, and feels like her core is weak and there's not a strong connection. And so besides my recommendation to do less, I also would like to guide the training more towards central body training. And so all the exercises that we're training peripheral muscles, like the quads and the calves and the hamstrings and everything, all of those muscles are going to be they are attached to our trunk. And so if our trunk is not stable, if it's not our powerhouse, then they don't have a strong foundation to operate from, and there's going to be alignment issues. And so they are levers, and the muscles are basically strings or ropes pulling on levers. And if the foundation of that pulley is not a strong foundation, then the whole rest of the lever, that system of the pulley, is going to be operating at a less than ideal state, or a less congruent state, and things start to wear out when that happens. If the joint is not in perfect alignment, if it's just slightly off, then we're going to have more friction. And so this is some of the basic foundations that I teach, and this is it coming into practice. And so there are some signs and symptoms of poor alignment. And so one of the things she mentioned was the cracking of the knees every time that it goes from being straight to bending. And so there's kind of two types of popping in the joints. One is the release of gas, and the other is structural, mechanical popping. And this would be mechanical because it's happening every time. It's repeatable. If it was the release of gas, it takes time for the nitrogen gas to rebuild back up. And so you can't just pop your knuckles repeatedly over and over, because that type of popping is the release of gas. So when the popping is repeatable, then it's structural, and so that's what's happening in the knees. And popping happens when there's things are not in perfect alignment. And so it could be different things. It could be the one of the tendons going over a bump. It could be the patella going a little outside of the groove. I can't be exactly sure. It's most likely the patella or the kneecap, but there are other things that it could be. The tibial tendon or quadriceps tendon could be rubbing over a bump called the tibial tuberosity. Could be the IT band. But either way, there's something that's not operating in the most best alignment. The there's and that's not the only place the cracking is happening. So it's also happening in the pelvis. One of the most common areas for the pelvis to crack and pop is the SI joints on either side, and those can be pulled out of alignment by tight hip flexors. Primarily is was one major reason why that would cause the SI joint to be out of alignment, and it can pop anytime. Oftentimes when it happens is when we are lowering our knee or our leg. So that could be during exercise, or it could be during just functional movement. So like, for example, bringing your leg down off of the bed. And you're sitting on the side of the bed and you want to take your leg off and put it on the ground. You get a pop in your really low down lower back or the up top of your pelvis. That's likely the SI joint being kind of like jolted at a certain point in the hip flexor lowering of the leg. So that's another symptom of both the knee and the pelvis are just symptoms of the muscles that around those joints being in a less optimal tension relationship with the other muscles around it. And then also hips popping and lower back cracking as well. So all of these I would point to as signs and or symptoms of kind of the umbrella term would be muscle imbalances. And then the urge to lock the knees in standing is this is something I've heard of before as well. I believe it's like a subconscious or unconscious attempt to try and correct or brace or just kind of address an imbalance in the body. So these are, to me, clear signs and symptoms, and it would make sense with all this training that's happening that potentially the limb muscles like the quads and hamstrings are being strengthened and tightened and maybe stretched and tightened, and that's it's kind of happening in a less than organic way because the foundation that they're attached to may not be strong and stable. And so again, my strong recommendation is to focus all of the training into the core or into the center, and pretty much forget about training the limbs until the center is stabilized. And so we have some more information here. So these are some questions I would ask anyone if they come to me, a patient or a student or a friend, anyone, if they come to me with a problem and it's a chronic problem and I want to learn more, the two of the most important questions you can ask yourself or that I would ask you are, what makes it feel better? When does it feel better? When does it feel the best? And what makes it feel worse? When does it feel like whatever you did was not good for it? And so this is something that it's really what it is it's listening to your body. And I'm just helping to instigate the thoughts of that reflection that is part of listening to your body. I've done an entire live stream on the importance. I believe it's one of the most important things that you can do to get out of any chronic pain condition, like a physical one, or even physiological, is take time to reflect on what you've done and how it impacted your body, whatever the problem is, and reflect on whether it helped or it hurt. And then you do more of what helped. So she says that moving more than sitting makes it feel better. So that's pretty typical for back pain. Anyone with chronic back pain, it's not 100%, but I'd say 80% is going to have more comfort with movement. They like that feeling of stability when the muscles are active, and when the muscles are relaxed, it doesn't feel very good because there's not a lot of stability in the resting state of the muscles. And that's what we want to try to achieve. Is we want to achieve a healthy level of tone in the muscles, the resting state, so we can rest and relax and feel good, so that the body is in balance when we're not trying to engage or tense something. Walking always feels good, and so does hip stretches, stretching in general. And she says, I think I tighten a lot when I sleep. It always hurts when I wake up. So stretching does feel good typically in the moment, and I would challenge anyone that if the stretch, to ask yourself, does it feel good hours or even the next day after stretching, or is it just temporary? The stretch only had an effect for maybe a couple hours, and then it kind of returns back. Because I think that's a really common experience, is that the stretching benefit is temporary, and that feel-good feeling we get from stretching is often related to just the movement of the muscle and a little bit of a release from the tension, and also increased blood flow because of that movement and a temporary release. So more oxygen to the muscles, feeling good. And so if the stretch is having a longer term impact, then yes, do more. But if it's offering temporary relief, then we need to do something that has more of a longer term benefit. And so we talk about active stretching in the program and how that can have a more long-term impact. And so it's just a matter of adding an active component to whatever stretch you're going to do. And another thing about stretching is that a lot of times when you have joints that are clicking and popping, like the pelvis, that stretching the muscles around it actually can make that clicking and popping worse. It can kind of, you're sometimes reproducing it during the stretch. And ideally what we want to do is we want to stabilize those joint movements, those kind of, cracks of the joints. We want to try and make them happen less. And then once we can stabilize the joints, then and we have central stability, we have spinal stability, then we can start to stretch our limbs and get more mobility in the distal joints. And so we call that central stability before distal mobility. And it's a school of thought that's taught and well understood and well practiced in the physical therapy profession. And so it just means stabilize your spine first. And so I'm kind of saying all this to say that I think that stretching could be held off for a little bit. And again, that focus back towards getting the core into state where it feels actively part of your movement and that it's turned on. When the body goes into pain, one of the things that happens is it goes into protection mode, and the core tends to shut off, and the body tends to want to just go into the fetal position. And those muscles that bring it into the fetal position, like the hip flexors and the chest muscles that tighten, those are tightening, and those are furthering the imbalances. And so in order for the body to be able to open and feel safe, we need to give it some stability in the center. And so just on to the next line, box jumps, running, deadlifts. Sleeping is another story. She mentioned sleep a couple times. I think that might be related to a mattress, and also sometimes sleeping is the best time to feel pure feelings, whether they're mental thoughts, mental clarity. When you wake up, what are you thinking about? And also in the body, when you wake up, what are you feeling? And that's sometimes just a time of day to be able to reflect on those feelings, because they tend to be more pure than after you've been doing stuff all day long. So the body's not happy, but it also could be the mattress, a poor quality mattress. So, and then, so deadlifts and stress, making it feel worse. So these two really stand out to me. They're high level, high intensity, complex movements. The body's not going to do well with stuff like that when there's imbalances in the muscles. So we would want to stop doing these things until we get a little bit more central stability. You can't stop sleeping. Deadlifts are something that they can be low impact, or if the core is not engaged, then they could be causing a problem. And so I don't necessarily say stop deadlifts, but we need to turn down the intensity and really focus on the quality of the form. It's not that complex of a movement. It's just a really critical movement to do right. And then stress is something that we all, that's a whole nother profession. So, but try and look at challenges as opportunities and change the perception of the stress is always a good idea. So daily pain levels, like low levels of pain, and then flare-ups into high levels of pain, and so that's not fun. She did have some questions. What do I think about swimming? I'm glad you asked this question, because swimming seems like a good idea for a lot of things, and it really is, but with knee injuries, especially if it's a traumatic injury, you really want to stick with closed chain exercise, which means that the end of the limb is attached to something, so like standing, squats, deadlifts, but when it's an open chain, and like you can think about the leg kind of flapping through the water, if there is an injury to the ligaments around the knee, I'm not sure if there is in your case, but it could, there's not enough stability. If you think about, like, say I had a wrist injury and I'm swimming through the water, that motion, sometimes there's a subtle amount of shaking that happens through the water, could really be stressful on the ligaments around my wrist. And there's nothing pushing up against it to provide stability like there would be if I was doing, say, a wall push-up, where that wall provides stability. With open chain, it's kind of like swinging around, and it's a lot of stress on the ligaments. So I don't necessarily recommend swimming, and especially also if it's a very complex movement. I believe that we want to you go back to the basics before we get into complex movements, because you could be just using all the compensatory muscles to do the swimming. And then again, I could be wrong. So you could try swimming, but if you do it and then you get out of the water and it feels not better, like not clearly better, and give yourself hours to let like endorphins wear off and see how your body feels like that night, then you may not be ready for it, because from the other symptoms that you're sharing, I believe that there's some things that need to happen before getting into the complex movements like box jumps, swimming, running, stuff like that. Another question: with push away while sitting, I know I'm trying to focus more on intent, but I do feel like maybe I'm creating tension. Yes, so it is going to fit in with this whole monster that we're dealing with of just kind of high stress, body in protection mode, some injuries, and the protective muscles that tend to turn on when we are using our body tend to be the ones that we don't want. And so how do we get out of this loop where we're using the wrong muscles and creating too much tension in these muscles? It's not easy, and it's not what you want to hear, but it's going to be about getting back to module 1, module 2, core balance training. I mean, that's what this program is all about, is start in the center and then progress outward from the center to the periphery. And so it's probably biased, maybe it's not, but you could only imagine that I'm biased in saying that my strongest recommendation is to spend a lot of time connecting to your anchors and core balance, because if you get up on that mountain and your body is starting to communicate to you that it's not happy, I think that's a worse situation than your body being tired up there. And I think probably one of the drives, one of the motivations for all the training that's happening in this, really intense gym regimen, and the other things that are happening, is to get fit, to get fitness up as high as possible to be able to do such an intense climb as Rainier. But I believe that it may be more beneficial to you to get the joints in alignment, and that can happen in 3 weeks if you really focus. The bridge can really help with the popping in the hips, because what the bridge does is it helps pull the femur back into the hip joint, and it can reduce popping directly. The knees are a little more peripheral, so there's going to be a slightly longer trajectory to get the knees to stop popping, but I think once the core muscles are on and engaged and stabilizing the spine, that the rest, what happens is it tends to just have a snowball effect on aligning the rest of the joints and the limbs. So yeah, my recommendation is to do core balance, do a lot of walking. I don't recommend the swimming. I don't recommend anything high intensity, high complexity, where you can't, in your mind, stay focused on the core and use your imagination to think about your core being the control center for all of your movement. So it's going to have to be simple movements, and then gradually add more complexity as you feel confident with that. So I imagine this would be relevant to a lot of people, and maybe not in the situation of having a short deadline to get to that goal, but it's certainly a place I've been in my life where it seemed like everything I did kind of just didn't felt a little off, and it didn't feel like I was able to help myself, even though that was my goal, was to help myself. I will share that part of the reason I developed muscle imbalances at such a young age and more severe than most people is because I started lifting weights heavily, bodybuilding at a very young age. I was age 13 when I started doing bodybuilding, and so I artificially created muscle imbalances by creating tension in certain muscles, getting really strong in certain muscles, and my body was formed by lifts I was doing in the gym and not based on my functional movement, which is the healthiest way to form your muscles. And so I think that doing lifts and heavy lifts and controlling the tension in my muscles through whatever ones I decided to focus on that day, and maybe lifting with poor form, even though I had a trainer and I was told I had good form. Maybe I wasn't using my core enough. I think that's what accelerated my problems to happen at such a young age. So I hope that helps, and we're going to move on to some other questions because we've been going for 40 minutes already, and we're going to bust through some of these other questions. So let's get on to a question on breathing. I do remember that there was a question I didn't fully answer on sitting. So we have another question on sitting, which I'll answer more about that when we get to the next question. So breathing. So it says, because I struggle to breathe into my back, I have found it easier to breathe into my pelvis as I relax this muscle. Okay. Relax as you relax the pelvis muscle or muscles. Okay. And the question is that okay? Is this as beneficial as breathing into the back? I am able to isolate and firm the front, lower abdominals, just above the pubic bone, transverse abdominis maybe, but I'm not sure I feel the breath into the back. Just want to make sure this is effective and okay to do. Absolutely 100% yes, I fully support breathing into the pelvis. So I'm really glad you asked this question. And so yes, do that. And actually, one of the things about the breathing into the back that what we do in the program is we are overcorrecting what is normally a tendency to breathe out the front, out the belly. And so we overcorrect that by breathing into the back. And the ultimate goal truly is to breathe down into the pelvis. And but we do need to overcorrect because for a lot of people the problem's been going on for so long that just correcting to what is right is not enough. And so we overcorrect and we try to get that expansion of the lower back, and it should feel good. But because of your situation, I believe that you can just go straight into breathing into the pelvis, which is the ultimate goal. And then another question is recommendations to ask or tell a pelvic floor physical therapist. Not off the top of my head, just share. Pelvic floor physical therapy can be quite intimate, and so my best recommendation is to share the most intimate things, the things that you may be embarrassed to share. Those are the things that could be the most valuable for the physical therapist. And so whatever it is that you might be debating, if you feel comfortable sharing, yes, share those things. Those are the most important things to share, and give as much information as you can, and then trust in the professional, because this is one of the more successful fields of physical therapy, I believe, more than any other field that deals with these types of problems. Physical therapists that specializes in pelvic health can be extremely effective, and so that's my advice for that. Next question, we have a sacroiliac issue with single leg exercises. So SI issue and stuck on the single leg exercises. Single leg stance is manageable, but every time I do the running man, my SI goes out. I have just started prolotherapy and it will be completed in 3 months. This is from Jack. So this makes a lot of sense. If you have an SI issue, that single leg anything will potentially irritate it. I like how you use the word manageable for single leg stance, meaning that it's doesn't feel great, but it's also not bad. So you're able to manage it, and that would make sense. But anytime you get to be more intense on a single leg than just standing on it, it goes out. And so best recommendation is reduce the things that could be irritating the SI and let it stabilize. It's actually just takes a matter of time of doing nothing that irritates the SI for it to stabilize. Like, could happen in a couple weeks. Doing the right thing, which would be, in my opinion, the butt buster bridge, really tightening back there, and then avoiding the activities like deep squats, any kind of hip external rotation stretch, like butterfly, figure 4, and sleeping on the side can irritate it, and you just want to get that stable. Prolotherapy can help speed up that process of stabilizing the SI, and then once you do, you gradually reintroduce single leg stuff. So it may not be running man, it may be single leg stance with a slight hip hinge, like a single leg hip hinge, which is not in the program, but you could imagine that that'd be a great regression of running man, similar to how we do the hip hinge before we do the deadlift. And so small hinges and then gradually progress. It's all about progression. So that's my best advice for SI, because single leg stuff does irritate it, and you want to get real strong and stable with double leg stuff before doing the single leg. All right, next question. Application to daily life, I titled this one. The question is, how can I move from my core with activities such as surfing and yoga? From Daniel. So Daniel is a CBT alumni. He's gone through the whole program. And so now we're applying the core anchors and the principles of the program to really high level, highly complex movements. And so my best recommendation for people in anything, and you can start even if you're early in the program, is that it starts in your imagination. So whatever you're doing, if it's riding a bicycle, for example, because I believe is a highly relevant example of an activity where there are great benefits to using your core as your source of power when riding a bike. So it starts in the imagination. I'm riding a bike and I'm imagining that my movement is originating from my core, and that is my source of power. And so every time I'm pedaling, even holding the handlebars with my grip and the stability I'm getting there, it is that stability and that movement is initiated with the core. And there is research to support that anytime you have a high-level athlete or high-level movement, and before that movement, maybe it's off the starting line like a race or something, the very first thing that happens is the very first muscles that contract are deep inside your core. That is a sign of healthy movement, and that is related to the highest level athletes in the world. Is the movement originates in the core, and so we can fall out of that pattern and have limbs become dominant. But to get back into that pattern, besides doing the program, my recommendation is to imagine it happening in your mind and feel it. Feel your core while you're doing the activities. Surfing is going to be a tough one because one of the crazy things about surfing is that it takes you out of time, and so it's really hard to focus on certain things when you catch a wave because you are so in the moment with the wave. You're flowing on, it's one of the only activities in the world where you're interacting with a moving environment that's unpredictable. So even different than like wakeboarding or something where you're riding the wake, a surfing wave changes and it's imperfect, and so you are having to react. And I think that one would be one of the hardest ones to be able to think about something like your core while doing it. But the only other way to do it is to train yourself over time until it becomes subconscious. And so that the way that's done is through daily, everyday commitment to a routine like core balance training, where you are training your body to move from the core, and that is over time enough for it to start sinking down into the subconscious, into unconscious movement where it happens automatically or naturally. Yoga, I would imagine you can really focus on your body while doing yoga. There's a controlled environment. So that would come back to imagination and just thinking about your anchors, maybe what you've learned in the program, and just having that intention of all movement originating from the core. Hopefully that helps answer your question, Daniel. We're going to move on to the next one. This is from Neverson. It's a general question. It says, when I perform some of the training, I feel like I need to brace my stomach, like I'm going to take a punch in the gut. I feel like my core is activated when I do that. Is it okay to do until I strengthen my core? The bracing technique, Neverson, is one technique that is taught for back pain. It's not what we teach in the program specifically because it's hard to control what is being braced, what is being engaged, and it could just be everything, like all muscles, and it sounds like that's what you're doing because when someone's going to take a punch in the gut, they brace everything. And so what we want to be able to do is integrate our style of bracing into all movement. And so that's not going to be flexing everything. That's going to be just having the connection with the deepest muscles, the deep core muscles that are closest to the spine. And those are the muscles, the postural muscles that we can use all day long with movement. And so my answer, as much as you may not want to hear, is I don't suggest that high intensity of engagement or contraction or bracing. I suggest reducing your intensity and feel what that feels like. Sometimes it just takes more time than we want. Often it takes more time than we want to reach the goal. And that's the hardest part, is turning it down, turning everything down a notch, and starting with the most simple, most controlled environment. And so that's the way the program is designed, is you're going to start with just connecting your back anchor and feel what that feels. And if it takes you a 100% effort to get your back anchor, your back of your rib cage, to touch the ground and to push into it, then in that case, that's when I would say it's okay, because that's step one. And so you need to be able to do step one and continue practicing that. And then the second part of your question is, until I strengthen my core. And so, yes, I fully agree with that. Once your core gets stronger and you're able to bring your rib cage down with a less intensity, say 50% intensity, then that's what you want to start practicing and start developing that control, that it doesn't have to be fully on or fully off, but there's that middle ground where you can operate your body with some engagement, but not full steam. And then that's where you want to start progressing into the other things like back anchor, progression, and the bridge. And that stuff is going to require more than 10%, intensity. But the goal is to be able to do those things with less intensity. So I guess it is a no and yes answer to your question, Neverson, is I don't want you to just flex everything, but you need to be able to do the basics. And so it's okay to go hard on those basics until you get stronger. And then as soon as you get stronger, to start reducing the intensity and being able to flex the deeper muscles without the superficial muscles coming in to help and compensate. Hopefully that helps. All right, we're getting up close to an hour here, and I've got 4 more questions, so it's not bad. Next question is about extended periods of sitting. I'm going to take a little water break here, still recovering from COVID. All right. So this is from Marcy. She says she has a couple of long flights. She tries standing and walking, but she's looking for other tips. She usually puts something behind her back, but I would imagine after a little while that starts to hurt too. She says, I can activate my anchors, but not for 9 hours. Yeah, that is not realistic. So I like this question, and this was that question I referred to earlier about sitting. So this will apply to our travel nurse as well. What I've learned about sitting over the years, being someone who sitting historically is the least comfortable thing for myself as well, is that there is no one sitting position that is going to be able to be comfortable for hours on end. Unless you are in a lazy boy and you found something that where your body can fully relax. But that's not true sitting. True sitting would be more comparable to working at a desk or typing or sitting on an airplane. And so my answer to your question, Marcy, is it's going to have to come down to variety and changing it up. And so if we're doing active sitting, it's going to be about getting up, going for a walk, sitting back down, putting the cushion behind the back, taking the cushion out, shifting over to one side, shifting over to the other, get up, walk around, sit down, do some leg exercises. And unless you're able to fall asleep, then it's just going to be like that. It's going to be changing up the pattern. And if you find a position that's comfortable for a longer period, then milk it and enjoy that for a while. And once it becomes uncomfortable, because any sitting position is over after a certain amount of time is going to be uncomfortable. It doesn't matter how good, the best back support in the entire world is only comfortable for a limited amount of time. So it's the variety that back support provides is what makes it comfortable for a little bit, and not necessarily that it's a great support. It just changes up your environment, and I think that's what the body loves. The body loves movement, the body loves variety, and anything that's repetitive is going to cause trauma over time. And so that's my best recommendation, Marcy, is even if it means just marching your legs, connecting to your anchors for a 5-minute period of doing some modified dead bug or back anchor challenge, just to change things up for 5 minutes. And if you're embarrassed to do that, you can do it really subtly, and just real subtle knee movements, and just feel that connection, and then move on to something else. Maybe it's reading a book for a little bit in one position, and then cross your legs a different way and do that. If you have SI issues, I don't recommend crossing the legs. That's one disclaimer. And then getting up and walking around, be that annoying person, because your body is worth it. So hopefully that helps. And then as far as pushing away is similar to the first question, is like sometimes it could feel like pushing away is creating more tension than the benefit that it's providing. And so clearly we don't want to do that. We want to just find a balance when you're connecting. Like what you said, Marcy, I can't connect or activate my anchors for 9 hours. Finding that balance and reducing the intensity, and you can work in that area of just gradual ramp up and ramp down, and feel yourself sink down into your body, and then push away. That's another subtle way to just kind of change things up and feel the relaxation in the sinking down. So you're letting that tension off and then returning it on. But just to hold something for a long period of time is going to create tension. And so even the push away is not meant for a long period of time. It's meant for you to become familiar and aware with this system, this push away system that we have in our body that we learn from infancy, but not to be held for lengths of time. It's going to be about ramping up and ramping down, and feeling those benefits for a short period of time, and then moving on to something else. I feel you on the airplane flights. I just had one, and I'm going to have another one pretty soon. So I'm right there with you, Marcy. Another one from Marcy is on the Hip Hinge. So she says, I walk for about 5 miles on most days. That's awesome. Honor you for that, Marcy, first of all. That's really great. And I support you to do more. And I hope other students get inspired to do that too from your post here. The hip hinge is up a hill is a new concept for you. You were staying straight using your anchors and concentrating on the glutes and quads. When I do the standing hip hinge with my arms overhead, it feels like a bit of a balance act. My butt sticks out and I grab onto the floor with my toes, if that makes sense. Is that the sensation I should have? Yeah, I mean, I do want the butt to go back. I don't want it to stick out in the way, like stink bug style. I guess that's a surfing term, but where your back is arched and your butt sticking out by arching your back. We don't want it sticking out that way. We want it sticking out through the hinge, and so all the motion is not happening at the lumbar spine. It's happening all at the hips, 100% at the hips, and the butt goes back. So yeah, we want the butt to go back as far as possible, and then you got to grab the floor if you go back too far, because you're going to fall. So those toes will activate and grab the floor. So yeah, I think that's right. And then as your balance improves, then you can get more confident with being able to find that limit of how far back your butt's going to go. And you can do it at maybe a little bit of a less toe grab intensity, because you have familiarity with that range of where you can go, and so it can become more of a natural motion. But I love that for training, yeah. And when the hip hinge goes into normal daily life, we're not going to be doing high intensity hip hinge like that, but you'll have more just muscle memory of how to hinge without needing to be at the edge of your balance. Okay, we've got a multi-part question here, and this is from Jotina. So I'm just going to read through this. It says, I have the strength to do these exercises to the half mark. I believe, she's going to talk about them right here. Back anchor of lifting into a bridge with the breath. Great. That's, I love that you are finding your limit and controlling that, Jotina. So I support that. And then the front anchor of using lower abdominals to bring the pubic bone to the floor. Yes, that's right. And then the problem is my legs do not lift just from the abdominals. That's okay. That's expected, Jotina. I will talk more about that in a minute. You say, only upon glute activity can I get my legs to lift off the floor about 1 inch. I have very low leg extension capability, and even with glutes contracted. When doing each exercise, I tend to get more pain in my right side rib and abdominals, along with pulling my spine to the right at T8 to L2. I may have some muscular imbalance in the abdominal area. Okay. And then the last part of the question is, can this program help correct a psoas imbalance? My right side is always more pulled anterior. If so, what module? So I think I put these two questions together, the psoas imbalance question with the above question about kind of shifting to the right, or the pain on the right, because I believe they're related. And so the psoas being tight on the right side, the pain more on the right side, pulling on the spine to the right side. Yes, it seems like there's an imbalance, Jotina. And so we're going to have to gradually correct that imbalance. And that's going to come in where we start addressing left to right imbalances is going to come in, I believe, module 8. We have to develop sagittal plane, front of body, back of body stability before it's even possible to balance out the left and the right, because if we don't have sagittal stability, front to back stability, and you try to balance left and right, you end up twisting. Your body ends up just twisting. And so we have to be able to keep that plane stable, and then we can do this kind of correction. And so let's go back up to the top. about you getting not much extension capability in your hips. That's going to be related to all this too. So the psoas tightness is what's limiting your hip extension, and um, and so this is where I think you should work is front anchor position, the push away. As I already mentioned, you're not expected to be able to lift your legs or push away, causing the legs to lift just from your abdominals. You have to have your glutes engaged for the leg to be able to get enough force to elevate off the floor through the push away. And so that's normal, Jotina. And even with the glutes, you're only getting about 1 inch. I think that's a little less range of motion than what I would consider normal, or what would be considered normal in the industry. And so you're going to want to work that range. Yes, you're going to need your glutes. Yes, you also want your abdominals engaged, and work on being able to get those glutes even more contracted and get the hips to extend even higher. And you can improve that through practice, simply through repetition and practice. That's something that I'm familiar with my body, is using the front anchor push away to increase my hip extension range of motion. And that's also an excellent way to address the psoas imbalance. So you can do more on the right side and get more length in that right psoas, because that is going to cause problems when you have an imbalance in the left to right psoas. Often causes problems in the SI joints. And so you're going to want to lengthen that right psoas through this exact exercise, the front anchors push away, and get that hip extension. Feel the lengthening in that psoas. Feel it open up the right side of your rib cage, your abdominals, and send your breath into that right side as well. So that imbalance can be corrected because it's in your torso, also by using the breath to help send expansion into those tight sides, and to reduce the pain through increased blood flow, increased oxygen, expansion of the tissues, and just generally correcting that imbalance. So that's my best recommendation. We do, so the psoas imbalance is going to be, to answer your which module question, is going to be starting to be addressed with the bridge, bridging up higher once you're ready. Until you get to full bridge, you're not going to be really addressing that imbalance. But once you get to full bridge, and you can start getting that stretch in the psoas while staying connected, you will be addressing that psoas tightness. And then the front anchor push away, yes, directly addresses the psoas tightness by getting extension in your hips. And then just continuing to progress those things, which we do with the front anchors challenge in module 3, and I wouldn't recommend pushing the hip extension on that one until you feel really confident with your connection, your core connection. But once you do feel confident, you can start to push that hip extension in that exercise as well. And then all of the bridge progressions we do as you get stronger in the bridge. The single leg bridge in particular will be excellent for lengthening one psoas as you're on one leg in the bridge, but that's going to come once you master the regular bridge. And then module 8, 9, 10, and 11 will all be addressing left to right imbalances. And so that's the last 4 modules in the program, because we really have to nail the sagittal stability first. So hopefully that answers your question. I would really be focused on the front anchors push away and getting that hip extension for you right now, Jotina. And yes, it's okay to do more on that right side and send your breath into that tightness as well. I believe we're on the last question, and we're at an hour and 14 minutes right now. So here we go. Let's get into it. This is a question from Guillermo. It's not a question. It's just sharing. He's sharing that he's struggling from moving from the back anchor progression into the bridge. And then Sherry, who has a question, is very related to Guillermo. So I just thought it was applies to both. She says, at what point would it be okay to progress to the front anchors in Module 2? She's been on the day 3, day 4 for a long time, the back anchor progression into the bridge, and she's still not at a full bridge and is wondering if it's okay to go to Module 2. So for both of you, Guillermo and Sherry, yes, it's okay to go to Module 2. We're going to continue working on the bridge throughout the program. I really admire you for spending so much time, both of you, on this first module and really getting confident with the back anchor. And I think both of you are ready to start the front anchors, and it's okay that you're not achieving full bridge while you start the front anchors. We're even going to have another bridge lesson in Module 2 and in Module 3. In pretty much every module, there's at least one bridge lesson. And so we're going to continue to refine that throughout the program. So yes, continue to move forward, and great job, both of you, at what you're doing. So because we've been going for an hour and 16 minutes, I'm going to wrap it up pretty quickly. I just need to take a breather because I'm still in recovery mode. So thank you everyone for tuning in, and I hope that you all get down on the floor and connect to your anchors. And if you sat and watched this entire hour-long stream, go for a walk and loosen up your hip flexors after so much sitting. So thanks again, and I'll be back next week to answer more questions, and hopefully it'll be a little bit more back on track with everything and feeling even stronger. And so until next time, give some love to your body that does so much for you. All right, take care.